So healthcare is actually very siloed. It's a multi-trillion-dollar global industry. 3.2 trillion only refers to the United States. And every part of it doesn't talk well to other parts of it. For example, we have patients who enter the system, and at every point there are problems that they have to face because of inefficiencies. That's just the very process of getting into the hospital. You have to meet someone in the business office. You have to get your bed allocated. The bed never is ready on time. The previous patient may have to exit. The room has to be cleaned, very much like a hotel. So that's the hospitality part of it. And then you have the actual hospital treatments, whether it's imaging or surgeries or chemotherapy, which have to be coordinated and are not always coordinated well, which means perhaps a longer hospital stay. And then there are the pharmacies. You need your medicines in the hospital. We have to be sure the right person gets the right medications. And when you leave the hospital, you also need to be prescribed medicines. And a lot of it, I can tell you, is still old-fashioned. It's written prescriptions sent to the pharmacist, who then fills it up, and then someone has to take it to that person. So that whole logistics of healthcare is also quite antiquated. Many of us think that healthcare is still the last dinosaur standing among many industries.
So why has it been so hard to develop a therapeutic product? And my talk really focuses on therapeutic biotech and clinical stage biotech companies. Well, you know, the harsh reality in life is that only 14% of all drug development going through clinical trials get an FDA approval. So people become really gassy, from investors to etc. Other thing, of course, and Prem has said this, is that these areas are very specialized. And so on the one hand, while we can understand these areas, on the other hand, it has become very complex and technical as well. And what about the fact that all the pieces may not be in place for a mature eco-cluster? I'm sure many people have a view, and I have a view here, but I think, to be honest, we have some world-class talent, and I think this will continue to grow. So if you compare now with 10 years ago and 20 years ago, we're in a much better place than we were 10 or 20 years ago. And what about the fact that we're not in the hot zone? So we're not in the hot zone of Boston, the Bay Area, or San Diego. And in this case, I would love to hear the views of Hussein, Chun, and Prem. Because honestly, even if you wanted to build a biotech company in maybe Portland, Oregon, you might also feel you're not in the hot zone. Because let's be honest, Kendall Square in Boston, and it's historically called Kendall Square, is really the mecca of biotech. And the issue, of course, is whether you need to have an office there in the first place, even though you're based in Singapore.